So, let's talk about prostatitis. You know, it's a condition that affects millions of men, but honestly, it's surrounded by a ton of confusion. In this explainer, we're going to cut right through all that noise and break down the three very different faces of this condition. Our goal? Make it simple, make it clear. Let's dive in.
Okay, let's kick things off with a quick question for you. When you think about prostate problems for men under the age of 50, what's the first thing that pops into your head? Probably something like prostate cancer, right? Or maybe BPH, an enlarged prostate. But what if I told you the most common answer is something else entirely?
Yeah, you'd probably be surprised. While those are absolutely major health concerns, especially as men get older, they aren't the main thing we see in the under 50 crowd.
The answer is prostatitis, and simply put, it just means inflammation of the prostate gland. Now, this can cause a whole bunch of really uncomfortable symptoms, everything from trouble with urination to pain all over the pelvic area. But here's the real catch. Prostatitis isn't just one single thing.
So, to really get a handle on this, we're going to follow the stories of three different men. Each of their experiences is going to show us one of the distinct types of prostatitis. All right, first up, we have what you might call the most dramatic version of this, the acute attack. Let's meet Mr. R. He's 38 years old, and up until this point, he's been perfectly healthy.
Then, out of nowhere, he starts feeling absolutely awful. We're talking a sudden high fever, body aches all over, just that general feeling of being really, really sick. And at the exact same time, he gets these intense urinary symptoms. It hurts to go, and he feels like he has to go constantly. It's an abrupt, totally miserable combination.
So what's going on with Mr. R? His diagnosis is acute bacterial prostatitis, or ABP. This is a straight-up, sudden bacterial infection that's taken hold in his prostate gland. You can think of it just like any other nasty infection you might get in your body, and that explains the fever, the chills, and why it all came on so fast. But here's the part that might surprise you. Even though ABP sounds incredibly severe, and it is, it's actually the least common type. It accounts for less than 10% of all prostatitis cases. So, what about the other 90%? Well, that brings us to our second case, which is a very different story. This one isn't about a sudden attack, it's about a frustrating on-again, off-again infection. This is Mr. F. He's 67, and he's been stuck in this frustrating cycle of urinary problems for a while now. Over the last year, he's actually been in the hospital 3 times for urinary tract infections. And get this, every time, it's the exact same type of bacteria. He also has this pain just above his pubic bone that kind of comes and goes, and some trouble getting his stream started. But unlike Mr. R, there's no high fever, no severe body aches, his symptoms just ebb and flow.
Mr. F's diagnosis is chronic bacterial prostatitis, or CBP. What's happening here is that bacteria have basically set up shop inside the prostate, creating this little reservoir that keeps causing these recurring UTIs. So he'll have flare-ups, but then he'll have periods where he feels relatively okay in between.
So how do doctors prove that the prostate is the real culprit? Well, they use this really clever diagnostic tool called the two-glass test. First, the patient gives a normal urine sample. Then, the doctor does a prostate massage, and right after that, a second sample is collected. If the number of bacteria skyrockets, and I mean like 10 times higher in that second sample, that's the smoking gun. It proves the prostate is the source of the infection. And that brings us to our third case. This one is the most common, and in a lot of ways, it's the most puzzling form of prostatitis.
So let's meet Mr. P. Now you'll notice he's the same age as Mr. F, but as you're about to see, his journey with pelvic pain is completely different.
For over 6 months now, Mr. P has had this constant, low-level pain in his lower abdomen. He also has some of that same urinary hesitancy. But, and this is the absolute crucial point, every single test they run for bacteria comes back negative. There is no sign of an infection. None.
Mr. P's diagnosis is chronic prostatitis/chronic pelvic pain syndrome, or CPPS. The definition is right there in the name. It's chronic pelvic pain that's been there for at least 3 of the last 6 months without any evidence of bacteria. It's what we call a diagnosis of exclusion, which just means doctors have to rule out everything else first to land on this one.
And this is the real challenge with CPPS. It's not treated like a single disease. It's seen as a symptom complex. The cause could be anything, from underlying inflammation to nerve issues, or even tension in the pelvic floor muscles. For a patient, hearing this is so important because it validates their pain, even when all the infection tests come back normal. It means there's no magic antibiotic. Instead, treatment has to be this personalized, multi-pronged attack,
looking at everything from pain management and physical therapy to even psychological support.
Okay, so we've met our three men, Mr. R with his sudden attack, Mr. F with his recurring infection, and Mr. P with his chronic puzzle. Let's put these three conditions side by side and see how they really stack up.
First, let's just look at how common each one is. And this is pretty striking. Chronic pelvic pain syndrome, the one with no bacteria, accounts for a whopping 90% of all cases. The two bacterial types, both acute and chronic, together only make up about 10%.
This table really just lays it all out, doesn't it? You can see the clear divide. On one side, you've got the bacterial infections. One is sudden and severe, the other is chronic and keeps coming back. And on the other side, you have the mystery of CPPS, which is all about persistent pain without an infection. And that difference in the cause is everything, because it totally changes the treatment. One path is a course of antibiotics. The other path, the far more common one, requires a much more complex, personalized game plan.
So, if there's one thing to take away from all this, it's this. While symptoms like pelvic pain and urinary trouble might seem straightforward, the root cause can be completely different. And that's why getting a proper diagnosis from a healthcare professional is absolutely essential to get on the right treatment path.
And that leaves us with one last big question to think about. We've just seen that chronic pelvic pain syndrome makes up a massive 90% of cases, yet it's this complex puzzle without a simple cure. So, if it's really this common, why is it still so often misunderstood and just overlooked in conversations about men's health? It's definitely something to chew on.